Your gastroenterologist should be asking about your mental health at every single visit. And if they're not, here's exactly what to say to make sure it happens. Hi, I'm Kate, and today we're talking about the mental health screening gap in IBD care. Because right now, new clinical guidelines say mental health screening should be standard at every single appointment, but most patients still aren't getting it. When my son was first diagnosed with Crohn's, his GI team was brilliant with his medical side. They monitored his inflammation markers, adjusted his medications, tracked his weight, but nobody asked how he was coping emotionally. Nobody asked about anxiety or sleep or whether the disease was affecting his mental health. And I see this pattern all the time. People come to me saying, I'm struggling with anxiety and my GI says that's not their area. Or I mentioned feeling depressed and they just referred me somewhere else, like it's a separate problem. But here's what I know: your mental health and your Crohn's are not separate issues. They're completely interconnected, and the medical world is finally catching up to that. So let's reframe this because there's a gap between what the guidelines say should happen and what's actually happening in most GI offices. In 2023, the American Gastro Association released updated guidelines stating that routine screening for anxiety and depression should be part of standard IBD care, not optional, not if there's time, but standard. And this isn't just about making people feel better, though that does matter enormously. It's because the research is crystal clear. Untreated anxiety and depression make Crohn's harder to manage. They increase inflammation, reduce medication adherence, worsen pain perception, and increase the risk of flares. Seems pretty important. Your mental health directly affects your physical outcomes. So, when we support mental health, we support disease management. But here's the problem: most GI practices haven't implemented these screening protocols yet. It's not that your doctor doesn't care, it's that healthcare systems are slow to change. Appointments are rushed, and mental health screening often falls through the cracks, which means you might just need to advocate for yourself. So let's talk about what should be happening, what questions you should expect, and exactly how to ask for this if you're not getting it. So firstly, you should know what the screening should be like. Mental health screening in IBD doesn't mean your GI becomes your therapist. It means they use validated screening tools to check in on your mental health, just like they check your blood work. The most common tools are simple questionnaires: the PHQ-9 for depression, the GAD-7 for anxiety. Now, the PHQ-9 is 9 questions about mood, energy, sleep, appetite. The GID-7 for anxiety, it's about 7 questions that concern themselves with worry, nervousness, and your ability to relax. They take about 2 minutes to complete. They give your doctor a baseline and help track changes over time. You should expect to fill these out at diagnosis and then regularly, ideally at every visit or at minimum every 6 months. Some clinics use digital systems where you complete them on a tablet before your appointment. Others use paper forms. Either way, this should be part of your routine care, not something you have to ask for. Understand why it matters for your physical health that these tests are important. Because this isn't just about feelings, this is about inflammation, immune function, and disease activity. When my son's Crohn's was at its worst, his anxiety was through the roof, and I could see how they fed each other. The anxiety made his symptoms feel worse, which increased his anxiety, which affected his sleep, which affected his immune system. It was a cycle. And the research backs this up completely. Studies show that people with IBD who have untreated depression or anxiety have higher rates of disease flares, more hospitalizations, worse response to treatment, and lower quality of life scores. And here's the really important part. When mental health is addressed, physical outcomes, well, guess what? They improve. Better medication adherence, better symptom control, and better overall functioning. Now, this is why screening matters. Not because mental health is a nice extra, but because it's fundamental to managing the disease well. So, you need to know what to say if you're not being screened. If your GI isn't doing mental health screening, you can bring it up directly. And here's exactly what to say. I read that the AGA guidelines now recommend routine screening for anxiety and depression in IBD patients. Is that something we can do at my appointments? That's it. You're not demanding, you're not criticizing, you're referencing clinical guidelines and asking for standard care. Most doctors will respond positively to this. They might not have implemented it yet, but when a patient asks, it often prompts them to start. If they say mental health isn't their area, you can say, I understand, but I'm asking about screening, not treatment. The guidelines say screening should be part of IBD management because mental health affects disease outcomes. Could we use a tool like the PHQ-9 or the GAD-7? So know what happens after the screening. That's an important part. Let's say you do get screened and the results show moderate anxiety or depression. Well, what then? Your GI should have a referral pathway. That might mean referral to a psychologist who specializes in chronic illness, connection to an IBD specific mental health program, referral to a psychiatrist if medication might help, and information about support groups or therapy options. What you're looking for is coordinated care. Your GI doesn't need to treat your mental health, but they should acknowledge it, track it, and connect you to appropriate support. And here's something important from my experience. The best outcomes happen when your mental health support and your medical team communicate. When your therapist understands Crohn's and your GI knows you're working on anxiety management, everything works better together. The other thing to do is to track your own mental health between visits. You don't have to wait for your GI to screen you. You can track your mental health yourself and bring that information to appointments. The PHQ-9 and GAD-7 are freely available online. You can take them monthly and track your scores. If you notice your numbers going up, that's information that your doctor needs to know. I also encourage people to track patterns. Do you notice your anxiety spikes before appointments? Does your mood dip when you're in a flare? Are there times of the year that make it harder for you? When we started tracking this, we realized his anxiety was highest in the week before his infusion appointments, not because of the infusion itself, but because of the uncertainty about whether his treatment was still working. Once we identified that pattern, we addressed it. Bring this information to your appointments. Say, I've been tracking my mental health and I'm noticing this pattern. Can we talk about it? Here's what I want you to take away from this. Your mental health is not separate from your Crohn's. It's part of your Crohn's, and screening for anxiety and depression should be as routine as checking your CRP or doing your colonoscopy. If you're getting this screening, that's amazing, and you're getting evidence-based care. If you're not, you now know exactly what to ask for and why it matters. My hope is that in a few years, this won't even be a conversation we need to have. Mental health screening will just be standard everywhere. But until then, you might need to advocate for yourself, and now you know how to do it. So if this helped you understand the mental health screening gap, then share it with someone else who needs to hear it. And if you want more support connecting the dots between your mental health and your Crohn's management, that's exactly what we work on in my coaching practice and in the Crohn's Method community. Have a beautiful day, and I'll see you in the next video.